What's going on, everyone? Happy Wednesday to everyone. Hopefully, everyone is doing well, safe, staying healthy. If you had to take a COVID test, hopefully you tested negative. If you're in the area of the wildfire smoke, hopefully you're limiting your time outdoors and staying safe. Welcome to the Wednesday edition of the Pandemic Update for Wednesday, June 7th, 2023. First, today we are going to start off with India, and then we are going to do all the news of the day, and we are also going to add something about the wildfire smoke today. We have to talk about air quality in the Northeast because it's impacting millions of people. And then when we get to the data portion today, we do have two new things to show you. One that has to do with wastewater, and the second that has to do with the CDC. The CDC, I think they added something new. It's something I've never seen before, and someone did tweet out that it was a new product. Then we're going to do all of our other regular business. So our video is going to go over 15 minutes today. It's going to be closer to 20 minutes today, and you may see this happen down the line from time to time on days where I have a lot more things to share with you, where I don't have to cram everything into 15 minutes. I mean, some days I have to leave out the international update, and it's like a mad rat race to finish these videos. So, anyhow, let's get into the India portion of the update, because we do have something interesting to show you on this. India added 214 new cases today. They actually added no new deaths today. But check this out. I found this on Twitter. It's not the first time I've seen wastewater from India on Twitter. I think a couple times before. I've never actually found a website which shows India's wastewater values. This is from TIGS underscore India, and this shows three waves of COVID. It shows the first Omicron wave, then it shows a wave last summer, then it shows the current wave, which they are coming down from right now. And when you take a look at this, here was the first Omicron wave. That got pretty high. Second wave was not as high. Then they had a long period of low levels. But look at the current wave that they just had. Look how high this got. This got really high. It got higher than the previous two waves, which is telling us that in India, much like the rest of the world, they missed a ton of COVID cases. Cases were really high, much higher than probably what we knew about. We probably missed hundreds of thousands of cases, maybe even over 1 million cases. I don't know what the real number was, but the point here is India definitely missed a lot of cases. All right, moving on to this. Remember the Singapore Prime Minister, Lee? He was positive for COVID, then he recovered. Then he tested positive again in what is considered a rare rebound case. To be fair, we haven't seen a celebrity have a rebound case in quite some time, but this is a political figure, and he did have a rare rebound case 6 days ago. Well, guess what? He has finally tested negative. So this is good. Hopefully now he does not have any long COVID issues. All right, moving on to Australia. We've been talking about Australia a lot lately. While we are entering summer here in the Northern Hemisphere in the United States and up in Canada, Australia is in fall, and they're about to enter winter. And Queensland COVID light remains on green despite rising hospital admissions for the pandemic virus and flu. And it says here almost 600 Queensland public hospital beds were needed for COVID-19 and flu patients yesterday, as some health facilities reconsider mask mandates. You know, these things, N95. You'll see me mention these more later in the video. Yeah, this is concerning. So their numbers are up. Remember, I've been saying this for multiple days now. When their numbers are high at this time of year, it's a bad prediction of what's going to come here in the fall and then winter. We follow what happens there. We did last year. Last year they saw an early wave like this. And what happened here? We watched COVID, flu, and RSV have an early peak. More so RSV and flu and other respiratory viruses. They really rose fast in the fall, then peaked earlier than the flu numbers, or excuse me, earlier than our COVID numbers did here in the United States. And based on what's going on in Australia, as of right now, we can suspect that may likely happen again here. What is uncertain here in the United States is, and the Northern Hemisphere, is what's going to happen this summer. Right now, we're still seeing the wastewater levels low. I'll show you that in a little bit. They're not rising in the 4 regions just yet. Moving on to our next story. Now talking about monkeypox cases. 2 monkeypox cases detected in Beijing. And the 2 are basically connected to each other. One was an imported case. The other was a contact of the imported case. And they did get a monkeypox positive test result. Moving on to this, there's actually some good news on monkeypox. Yes, you heard me correctly. There's some good news. Moderna is set to test a new monkeypox vaccine in humans this summer. So they are going to be testing a new monkeypox vaccine, and hopefully they'll get good results. And if they do, that can get passed on to the FDA, and maybe by sometime at the end of this year or next year, we'll have another monkeypox vaccine that we'll be able to use. Alright, this is relatively interesting. I may have mentioned this before in the videos, I may have not. I know I've retweeted and tweeted on it before on Twitter. Mysterious COVID strain is found in Central Ohio. Basically, there's a person in Central Ohio that they believe, the health department believes, has been infected for 2 years and is shedding a high viral load of the virus. Now they're saying it's not a threat to public health. Honestly, we don't know. If someone's been infected, tested positive for 2 years, or at least showing up in the wastewater as positive for 2 years, how are we to know that that person is not shedding viral load? We don't. It's just interesting. It's something we're going to keep monitoring. And the Ohio Health Department, they are actively trying to find this person. Virologists, people who actively study this stuff, deep dive into the data. They're trying to find who this person is. Alrighty, moving on to some data out of West Virginia. We're just going to read a headline for this. West Virginia Department of Health and Human Resources reports 4 new COVID-19 deaths. So this would be in the last week. I didn't see anything in here about the total number of cases this week. Maybe it's in this picture here. Let's see. Yes, there we go. 160 new cases added from West Virginia in the past week. Alright, moving on to this. Not the first time I've reported on one of these outbreaks. Not the last time. But it is the first time that we've seen it in New Jersey in some time. And I think you've probably read it by now. Nearly 200 passengers aboard Celebrity cruise ship from New Jersey to Bermuda suffered explosive diarrhea to norovirus outbreak, Daily Mail reports. Yeah, cruise ships are well known for viruses. There was the Princess Diamond COVID outbreak at the start of the pandemic, which was really a bad problem. Alright, moving on to our special segment today on the wildfire smoke. This says, this headline, breathing in wildfire smoke comparable to smoking 3 to 11 cigarettes a day. And that's true. In some places today, might actually be more cigarettes than that because the air quality is so bad. I want you to see this picture. This is from New York City. Now, I'm probably going to have people comment from the Pacific Northwest saying, oh, we dealt with this for the past 2 years. I totally get that, but for here in the Mid-Atlantic and the Northeast region, now mind you, Boston on northward, they're not dealing with this. They have an area of low pressure that's spinning around, and that's part of the reason why we're seeing the smoke getting pulled down. But up there, they're actually seeing clouds and showers today. But to look at this for New York City, this is most unusual, at least for this day and age. Maybe back in the 60s and 70s, day of the coal. Yes, maybe you saw smog bad like this, but for recent times, I don't recall in my lifetime ever seeing a daytime picture of New York City be this smoky. It's bad. And take a look at the air quality levels. I don't ever recall seeing air quality levels this high in the Northeast and Mid-Atlantic region. Take a look at this. Let's take a look at the different numbers here. These are the PM levels, and you can see they are really high. We'll start off with New York first. You can see we have 200s, 300s, yes, even a few 400s. You really want to limit your time outdoors. Central New Jersey, widespread 400s, even 500s. Now, I saw one just a few minutes ago that I thought was really interesting. It could be a glitch. Maybe it's not a glitch. This is in southern New Jersey. This is near Pennsauken, New Jersey, I believe. Yes. 696. That is extremely hazardous hazardous and dangerous. You want to stay inside in that area. Do not go outside if you are in that area. And incidentally, that is just east of me, so that is really, really concerning. And you can see these levels, though be it they're not as high in the DC area, it's still in a dangerous category. Over 100 to 150, that's still dangerous. So you want to limit your time outside. If you do have to go outside and you live in the Northeast today, maybe you're in upstate New York, you're in Pennsylvania, maybe you're in my area, Philly, you want to wear a mask today. It's extremely important. Also, let's just take a look at this satellite picture. You can see here's that plume of smoke as it comes around. There's going to be another round tomorrow that's going to be slightly more west. Some of that may come into the mid-Atlantic. After that, it should get better for the weekend. Then we just have to watch. Eventually, this low is going to shift back east. We'll have to watch and see if there's another round late into the weekend. As of right now, I'm saying no, but don't quote me on that. We'll have another update on this again tomorrow. Alright, as you know, Walgreens did update this week with a 23.5% positivity nationally, and the prior week was 22.9%. Moving on to this day in COVID pandemic history, June 7th, 2021, CDC finds that the Pfizer, BioNTech, and Moderna mRNA COVID vaccines reduce the risk of infection with SARS-CoV-2 by 91% and protect against severe illness and hospitalization if a breakthrough infection does occur. Again, this was back in 2021, June 2021, before Omicron came and just changed the whole ballgame. Alright, moving on to this. Wastewater, as you see here, wastewater nationally, all 4 regions, continue to drop. We're going to take a look at a bit more wastewater in a little bit. Taking a look at the latest variants, XBB.1.5 is 53.8%, and as you know, XBB.1.16 is on the rise at 15.1%, and XBB.2.3 is at 4.9%. We will have an update for you on this, hopefully on Friday, as the CDC does promise to do bi-weekly updates. Alright, something new, and I have to move myself to the left so you can see this. This is from the CDC. This is U.S. change in percent of emergency department ED visits diagnosed as COVID-19 from the prior week. And as we take a look here, the green, or let's start with gray. Gray is insufficient data. Substantial decrease is this like lightish green color. And then you also have another green color with moderate. Then you have stable in the yellow. Then you have moderate in orange. Then you have bright orange, which is substantial increase. So you have moderate decrease. Then you also have moderate increase. And then you have stable in between. Let's take a look at the different regions, shall we? And taking a look here, you can see, generally in the West Coast, it's not doing too bad. They are seeing decreases in the West Coast, substantial to moderate decreases. Then you come up here to Colorado, Wyoming, Montana, and North Dakota, and you can see it's in the yellow, which represents a stable condition. And much of the southeast is stable. You do have some areas that are decreasing, but you come to New Jersey, then Connecticut, then you come to Vermont and Maine, where you're seeing a moderate to substantial increase in emergency department visits for COVID-19. So that is relatively concerning, something we don't want to see. Also, something else that's new on the channel. We're just going to do a couple sites here. This is in relation to wastewater. We'll do a couple sites each day. I was going to do a full video for this. I don't think so. We have enough other stuff that we do as full videos as is. And basically what we see here is, yes, we can look at our normal wastewater. So let's do this. But we can also look at influenza, respiratory, humane, that's the new virus. We have monkeypox and norovirus levels as well. And take a look at Boston. We can see SARS-CoV-2 in Boston. The levels, they are dropping ever so slightly here, at least so it says. Remember, there was a rise at the end of May, and according to this, it is starting to drop some, which is different than what we were seeing in the Boston wastewater facilities. Remember, we showed you, I believe it was last Saturday, that Boston wastewater was slightly rising. Not seeing that here, at least from this data standpoint, and this could be completely different. wastewater sites? I honestly don't know. Newark, New Jersey. Here's SARS-CoV-2. You can see here, it is slightly starting to rise. Then we come down here, no monkeypox detected at this time. It says not detected. Let's take a look somewhere else in the country besides the East Coast. Let's go out to, how about Ohio? We often mention Ohio, and you can see SARS coronavirus in Ohio. Levels are dropping. Influenza, non-detected at this time. Norovirus, there are some levels of norovirus being detected, so especially nursing, senior facilities, that's an area that you want to be concerned about. Monkeypox, non-detected at this time. Let's go elsewhere around the country. How about we come down here to Dallas, Texas? What's going on there? And in Dallas area, you can see that SARS-CoV-2, coronavirus, it is dropping at this time. Influenza is low. You can see respiratory RSV is low. And then that HMV that you've been hearing about, that is low. Norovirus, there are some levels of norovirus being detected here. And you can see here, back in April at one point, there was a detection of monkeypox. Currently, it is not being detected. And we'll just do one more area, which will be California. Let's do, oh, I don't know. How about Los Angeles? Let's just go down to, here's a relatively big one, LA itself. LA is holding steady. And what's interesting here on this, it's updating. When you take a look at LA on the CDC site, we always constantly see it flat. And here it does update. So it is bouncing around a little bit, but it's not rising, and that's good to see. Influenza, flu is low. RSV is low. HMV is low. Monkeypox was detected. When is this? Back in March, there was the case being detected, a high level for 1 week. And norovirus, there is some detections of norovirus, though not as high as what we saw in Ohio. One last thing that I want to show you, and this is a Massachusetts Department of Health website, and I think we are going to start incorporating this into our videos as well. And I want to show you Providencetown. Here we go. Nope. We have to remove this Amherst. And I wanted to show you Providencetown, which was a big area for Memorial Day weekend. It looks like it's not coming up. Okay, we'll add this tomorrow, but this is a Massachusetts website for wastewater that I do definitely want to start showing to you in the videos. Tomorrow we're going to do our forecast from the HubUp Data World. All right, New Jersey for today. I have to refresh this to make sure it's up to date. And New Jersey for today for hospitalizations, you can see 69 out of 70 did report, and 192 hospitalizations total. So that is not over 200, which is what we like to see. 9 people on a ventilator, and in the ICU we have 20 patients in the ICU in New Jersey. Now moving on now to some local numbers here. And I'm going to move myself back to my normal spot. And we can see on some local numbers here, I wanted to show you, here it is, the EMS calls for Philadelphia, 769. I would have thought it would have been over 800 yesterday because of the wildfire smoke, but 769, you know what? That's acceptable. It isn't a concerning level, but considering what's going on with this wildfire smoke, it's not terribly concerning. And let's take a live look in at some current activity locally. And I thought it would have been busier. Earlier, it was actually slower, so it did pick up a little bit. 16 incidents. Earlier around lunchtime, it was actually down to just 5 incidents in Montgomery County. We do see a few respiratory incidents, which that is concerning. Taking a look at Chester County, again, not terribly busy considering what's going on with the smoke. So Southeast Pennsylvania is not doing terrible right now. Let's take a look at New York State and the latest positivity and case numbers. 398 cases in New York State, 4.0% positivity, 3.5 is the 7-day average. We're not seeing numbers near 5%, but they're not dropping terribly as well. So it is still concerning. And remember, these case numbers do not include reinfections or at-home test. Taking a look at New York State hospitalizations, as always, it's going to refresh on us, which is just as well because it was still showing yesterday's numbers for a good part of the day today for some reason. And hospitalizations, New York State, they actually dropped today. 557 people in the hospital, 63 people in the ICU for today. And taking a look at New York City, and New York City's numbers, yes, they are still rising. 213 hospitalized patients and 23 people in the ICU for today. How about Texas? We did get our weekly update out of Texas. 3,963 new cases this week. And coming down here to hospitalized, 601 people in the hospital versus 635, and 30 fatalities versus 37. So all the numbers in Texas for this week did come down. Updating on the international standpoint, South Korea, cases are up 0.8%, just shy of 1%. Deaths are down 8%. Around the world, cases are down 27%, deaths are down 29%. Brazil today is up 11% on cases. Remember, they're entering wintertime over in Brazil, and they're also seeing a 58% increase in deaths. France, cases are starting to rise once again, up 6%. Deaths are up 9%. Then we come down here to Spain. Spain cases are down 57%. Deaths are down 58%. New Zealand, cases are down 20%. But, as you know, deaths always lag cases, and their cases are up 74%. Canada, cases up just about 0.5%. Deaths, however, are up 115%. That's not good to see. 189 versus 88. Mako, cases are up 28%. 1 death versus 0 deaths. And finally, today, we will end it on Colombia. 62% increase in cases and 143% increase in deaths. Alrighty, folks, that does it for today's pandemic update. I'm seeing this has gone over 21 minutes. It's a bit longer than normal, but I wanted to include all this extra data. And plus, we're doing a little bit different with our recording program today, which allows us to go beyond 15 minutes now. I upgraded myself because on busy news days, I want to get the data in there as much as possible. I don't want to do it rushed, and I want everyone, I want you all to stay safe. And in order to do that, I want to get as much stuff out there as possible. And it's amazing to me that we're even finding new sources of data at this standpoint when there is such little data left compared to a year or two ago. Alrighty, everyone. Thanks for watching this video. If you like this video, give it a thumbs up. If you want to see more content like this, subscribe to my channel down below and give me feedback. Do you like it when we do these a little less rushed, maybe a little bit longer? We'll probably do this. It won't always be like this, but give me feedback down below of what you think. Alright, I'll see you all again next time. Until I see you again next time, stay safe, everyone, and have a great afternoon.